So let's walk through a facelift incision design. A lot of patients will ask what the incisions look like and why we design them the way that we do. This is the typical way that I design these incisions. Every patient's a little bit different based on their anatomy. Every surgeon has slightly different techniques, but this is the common way that we do it. This area here, referred to as the sideburn, we call it the temporal tuft. It's really important to preserve this sideburn. When incisions are made straight up or into the sideburn, as we recruit the skin up and back, you can lose that sideburn. We then move the incision into the area in front of the ear. We call this the helical root. And the helical root, we know where that anatomic demarcation is because when we push the ear forward, we'll see a natural little crease form. And that's the natural place that really just kind of asking for that incision to be made there. We then bring the incision right into this little nook as we go into the tragus. Tragus is this little piece of cartilage here. And this is really important to really camouflage that incision. We don't like to go inside the tragus, but we go right along the edge of the tragus to preserve the anatomy. We pop out below the tragus into the earlobe. When we have to decide where we're going to bring the incision behind the ear, I like to find the point where the pinna of the ear, where the most posterior part of the ear meets the hairline. So that's our little point right there. And instead of going all the way up into the crease and then over, I like to actually make a incision that's kind of a straight line, which is more consistent with the vector of the pull of the neck and jawline. We then go into the hairline behind the neck and we stop at a level somewhere around the earlobe, sometimes a little higher, sometimes lower, depending on how much skin we need to remove. And by using a beveled incision through the hair follicles, the hair is actually growing from that incision. So it becomes very, very well hidden. And you know, when you design a facelift incision like this and use other techniques on closure, including, minimal tension and really nice suture appearance, these incisions become very, very hard to see even at 3 to 6 months. And patients typically wear the hair up and feel very confident.